Okay, a couple of things they didn't show that can also be important. You would normally probably before you took your sample swab the toe with just an alcohol wipe, okay? Because what you don't want is any cross-contamination of anything else that you might have been doing to that patient's nail. So the alcohol swab doesn't destroy fungus, okay? It doesn't have the capacity to do that, but it does have the ability to get rid of any sort of transient microorganisms that you don't really want them culturing because they're not sort of causing any real sort of infection. They talked a lot about a bone curette. Yeah, you might use a bone curette, but probably not in the realities of everyday practice. You definitely use your nail clippers, your Black's file, and even though they're sort of saying the disposable scalpels are not ideal, their only concern with that is that you might actually slice the patient as well while you're doing it. So you don't want to introduce blood into your specimen. It's not going to be helpful. So you might sort of stick to your Black's file and clippers. There's a thing like a beaver's blade, tiny little micro blade that you could also probably use. You need your collection card or container. As I said, I reckon most often you get sort of the container coming from the GP with the client. You will need to be aggressive. They showed with that sort of blunt scalpel, they were actually using quite a bit of firm pressure to really get stuff out of that nail. And while it can make your stomach turn a little bit, you saw them sort of sticking the swab right in sort of underneath the nail plate and all that sort of stuff. You just get used to doing that. You just get your things right in underneath the nail there. As I said, very often, it's not uncommon for clients to say, you know, this nail is also, it's catching on my socks and I'm worried I'm going to rip it off, or I've already ripped a bit of it off and all that sort of thing. So very often I sort of say to patients, you know, now as part of the sample, me collecting the sample, I wouldn't mind actually clipping this nail right back as far as I can possibly go where it's not attached to your nail bed. And they usually want that anyway because it's a loose sort of nail is just going to get caught on the sock and just get ripped off completely at some stage. So often do that. The key thing is this adequate sample. They're trying to look at your sample under microscope. They're trying to then grow stuff from it, okay? And it's not uncommon with inadequate sampling for the patient to come back really disappointed because even though you know clinically there is an onychomycotic infection there, the test from the lab come back saying there's nothing there. Okay, we weren't able to grow anything. And it's usually sort of bad collection of sample. Oh, back down. There we go. All right, wound swabs. They showed a bit of the wound swab sort of stuff that was happening there. Not specifically for a wound, but they were using the sort of swab sticks that we're talking about. Wound swabs come, again, you can usually purchase them from the pathology company, or your local pathologist will be happy to supply them to you anyway. You get a swab stick that sits inside a transport medium tube. So that there's actually a fixating agent in there so that it preserves anything on the swab, okay? And allows you to transport the swab without it getting contaminated and all that sort of thing. In the context of a chronic wound, you're really sort of debriding. You'd sometimes use sterile saline to help soften skin tissue and crusty stuff that, particularly if the wound has got had a bit of air contact and it started to dry out. It's going to be incredibly painful if you start debriding that sort of scab-like tissue from the surface of the wound. So if there's anything like that, you want to try and moisten that material as much as you can to make it as comfortable as possible for the client. You're trying to get, on your swab, you'll be getting samples of the slough, the sort of exudous material that you get from wounds. Any necrotic tissue, black sort of coloured tissue, dried exudate. There could be lots of things. So you've really got to try and clean that wound as much as you can before you start taking that material away. Okay, you want to get skin tissue on your wound swab. Okay, you want to get the sample from the wound surface. You don't want to get any of this other stuff that could be hanging around there. Necrotic tissue, it's dead tissue, it's not viable, so it's not going to return anything live or wonderful. You take the swab stick from its packaging, dry the wound, and you just moisten the tip of the swab a little bit with a bit of that sterile saline, okay? And there are different ways of then just sort of swabbing the wound. The Z stroke techniques described here, the Levine technique, all right? So there are a couple of techniques. You'll get shown how to do this, probably in the context of clinical placements where you might find yourself in high-risk foot clinics or chronic wound services and stuff like that. Okay. You pop the swab back into the transport tube, seal it all up, label it, complete the form, and off you go, kind of thing. That's just an example of a form you might see. So clinical notes, you would just sort of basically pop in here, you know, question onychomycosis of left first toenail or whatever it might be, okay? Or you might, and the test you're requesting is sort of your normal, you know, fungal mycology examination, or complete mycology examination, and that will imply you want microscopy and culture. And it's also worth sort of noting in the clinical notes, attempting to prescribe oral terbinafine. Okay, because if the pathology knows that you're doing the test because you're trying to get an oral terbinafine script, then they'll make sure they just do everything possible to try and see if they can get something to grow for you. Okay, there we go. All right, so microscopy and culture. Microscopy implies looking directly under the microscope. Okay. The nice thing about this is you can get usually some sort of preliminary result within a few days. Okay. And culture takes a little bit longer. It takes close to 4 weeks. Okay, for results of your culture to be known. Different techniques, but predominantly the potassium hydroxide technique is the one used to try and prepare your sample for viewing under the microscope. Can you take a guess or hazard a guess as to what the potassium hydroxide will try and do to the sample?
Dissolves the keratin.
Yeah, it dissolves the keratin. Okay, so you're basically trying to dissolve the constituent material of the nail or skin tissue, the keratin, so that you then expose the fungal hyphae. Okay, those core structures of the actual fungus itself. Okay, and you can see hyphae under microscope. It's quite visible. All right. So they use a very dilute solution of potassium hydroxide. It's often combined with inks and stains to bring up colour under the microscope when they're taking photographs and things like that. They generally heat that. Okay, they heat that because they have to burn off the potassium hydroxide that's actually started to dissolve the keratin. Okay. So you can see here, this is sort of classic septate hyphae from a dermatophyte. Okay, under microscope as it would appear. Okay, so these nice long strands made up of individual sort of septae. Okay, so that's usually readily sort of viewable in your sample if you've got some good sample. So if you got that, you would get a report back saying fungal microscopy positive for, and sometimes they can actually try and sort of identify or make some guess at the sort of organism you might be dealing with. They can do bacterial microscopy and all that sort of thing to rule out any kind of bacterial infection. And you know all about gram stains and stuff like that, so I'm not going to spend any time on that. Then they'll go and culture. Okay, so they're just literally trying to grow the organism that's creating your infection and seeing what they've got there, and they can usually then identify that down to the specific fungus that's responsible, or bacteria if it's a bacterial culture. So they use different. You've seen Petri dishes with this. You would have done some of this in microbiology, I would have thought. So I'm not going to talk about that anymore. So microscopy, 1 to 3 days. The interim culture report, usually at the 7 to 14 days. Final culture report, up to 21 days. It might take a little bit longer. Okay. And then, of course, what they can do in Petri dishes is they can actually sort of look at, particularly in the case of bacterial infection, they can actually introduce particular antibiotics and see whether they get inhibition of growth on the Petri dish. So you start to get some idea of what antibiotics would be particularly sensitive for the bacterial infection that you might be dealing with. Okay. So you get the report back and it confirms whether there's fungal or bacterial infection. Public sector versus private sector. Okay. I guess here the point is, these things can often, in the private sector, once you got the results back, they'd often probably go to the GP first, if he's the prescribing or referrer. Okay. So you'd usually be relying on the GP either communicating back with you and saying yes, the results came back, or the patient telling you next time, kind of thing. All right. If you're an endorsed podiatrist to prescribe medication, you could feasibly then prescribe antifungal therapies. It's on the approved prescription list for endorsed prescribers. But you might need to refer back to the GP for that oral terbinafine script, Lamazole script, okay, if you're not an endorsed prescriber. Okay. In the public sector, you tend, if you're a podiatrist in a podiatry department in a major sort of hospital, you just wander down to your mate, the medical consultant, and just ask for a script for oral terbinafine, and they'd write it up for you. Okay. It's obviously a lot easier when you've got everything sort of co-located in the one organisation.